Imagine a man who is 72 years old. Let's call him Arthur. Arthur has been living with a known heart condition for 5 years. He watches his sodium, takes his daily blood pressure medication, and walks a mile every single morning around his neighborhood in Ohio. He feels good. He feels stable. Then comes his annual checkup. He walks into the clinic feeling perfectly fine. His doctor looks over his chart and says, "Since you have that heart history, let's just run a few routine tracking tests to be totally safe." 4 months later, Arthur is sitting in a rehabilitation facility. He is recovering from an invasive surgical complication that had absolutely nothing to do with his actual heart. His morning walks? Gone. His independent routine? Shattered. And the stable life he had before that afternoon appointment is completely upended. This story happens across America every single day. If you are over the age of 65 and you have already been diagnosed with coronary artery disease, a past mini-stroke, or mild heart failure, you have an invisible target on your back in our healthcare system. The moment a diagnosis of heart disease is written on your medical record, a highly aggressive, automatic pipeline of routine screening gets triggered. But here is what they never tell you in the waiting room. After 65, if your heart is stable and you have no new symptoms, some of the most common routine health screenings do not protect you. Instead, they do the exact opposite. They expose you to extreme, unnecessary dangers that can steal your independence in a matter of weeks. Today, we are going to look at the hard medical facts. I'm going to walk you through the 4 specific medical tests I would personally refuse or heavily question after 65 if I had a history of heart disease. We will examine exactly why the risk-to-benefit math changes completely when you turn 65, how pre-existing heart plaques alter your body's response to everyday tests, and the precise questions you must ask to shield yourself before a single needle touches your skin. When you are 50 years old, the medical system treats you with a strategy called aggressive prevention. The logic is simple. Find a microscopic issue early, fix it with an intervention, and buy yourself 30 more years of active living. At that age, your blood vessels are flexible, your kidneys are resilient, and your body can bounce back from the physical stress of a heavy medical procedure within a few days. But the moment you pass 65, and especially if you carry a diagnosis of heart disease, that entire framework flips upside down. Here is the truth that very few doctors will say out loud during a brief 15-minute office visit. When you have heart disease, your cardiovascular system is already operating under a delicate balance. Your blood vessels have areas of narrowing. Your heart muscle may work slightly harder to pump blood through your body. Your kidneys are working at a lower baseline capacity to clear toxins. Because of this, an everyday test that is completely safe for a healthy 50-year-old can throw an older heart patient's entire system completely out of balance. The modern medical system is built like a massive assembly line. Once a test comes back with a slight abnormality, you are instantly pushed onto a fast-moving conveyor belt towards specialized scans, biopsies, and surgeries. The system does not have an easy way to hit the brakes. Quick favor before we go any further. Drop your city and state in the comments right now. When I see exactly where you are watching from, it helps me tailor this health guidance for the specific challenges and medical environments you face in your home communities. I read every single comment personally, and it helps me know exactly who is listening to this message. Now, please stay right here with me because what we are about to look at next exposes the single hidden trap that catches thousands of stable seniors completely off guard. To understand why these 4 specific tests become so hazardous, we have to look closely at a devastating real-life case that demonstrates exactly how an innocent checkup can spiral rapidly out of control. Let me tell you about a man named Henry. Henry is 73 years old, a retired high school history teacher living just outside of Atlanta, Georgia. Henry is a classic example of someone managing their health beautifully. He had a small stent placed in his right coronary artery at age 67 after experiencing some mild chest tightness during his yard work. Since that day, Henry did everything right. He took his low-dose aspirin, kept his blood pressure right at 120/70, and walked his golden retriever twice a day. He felt perfectly healthy, completely stable, and had zero complaints about his heart or his energy levels. But during his routine annual physical, his physician noticed that Henry hadn't had a particular screening in several years. The doctor said, "Henry, because you have that history of heart disease, we need to be extra vigilant. Let's just schedule a couple of standard preventative checks to ensure everything else is working fine under the hood." Henry, wanting to be a responsible patient who follows expert medical advice, readily agreed. He didn't think twice about it. It was presented as completely standard care. Within 2 weeks of that routine recommendation, Henry found himself trapped inside a fast-moving medical whirlwind. The first standard test found a minor, ambiguous irregularity, the kind of microscopic finding that is incredibly common in a 73-year-old body and would likely never have caused a single symptom in his entire lifetime. But, because that finding was printed clearly on a white piece of paper, the medical assembly line picked him up. He was referred to a specialist. The specialist ordered a more detailed, invasive follow-up scan. To perform that secondary scan safely, Henry had to temporarily stop taking his daily blood pressure and heart medications for 48 hours. That sudden disruption threw his stable cardiovascular system completely out of alignment. His blood pressure spiked drastically, putting intense pressure on his arteries. During the procedure itself, his heart rate rocketed, and the sudden stress triggered a dangerous, irregular heart rhythm called atrial fibrillation. Henry didn't even make it to the final results of the preventative test. He spent the next 9 days in a sterile hospital bed, hooked up to intravenous lines, trying to stabilize a cardiac emergency that was caused entirely by the process of looking for a problem he didn't even have. What happened to Henry has a formal name in the academic medical literature. It is called the medical cascade effect. It is the single most dangerous hidden mechanism in modern senior healthcare, and it is precisely why having a pre-existing heart condition changes every single rule of preventative medicine. The cascade effect works like a line of standing dominoes. The first domino is never a major surgery or a severe medical crisis. The first domino is always an innocent, routine, preventative screening test performed on a person who feels completely healthy. When you have heart disease, your body's internal plumbing is fundamentally altered. The blood vessels that feed your brain, your kidneys, and your limbs often contain small, stable layers of calcified plaque. This is normal aging, and when managed with proper medication and a healthy lifestyle, these plaques can sit quietly for decades without ever interrupting your life. But a routine preventative test does not know that your plaques are stable. When a standard screening test detects an ambiguity, the medical system reacts with high-alert protocols. This is where the real danger begins for a heart patient. The follow-up tests often require 3 things that an older, compromised heart simply cannot tolerate well: heavy chemical dyes that strain the kidneys, rapid fluctuations in fluid levels, or the temporary stoppage of critical cardiac medications like blood thinners or beta blockers. If you drop your blood pressure medication for a test, your heart muscle suddenly faces immense resistance. If you stop a blood thinner, those stable plaques in your arteries face an immediate risk of forming a microscopic clot. This means the diagnostic process itself carries a steep physical cost. The medical system was built around a statistical average of a 50-year-old body, but it applies those exact same protocols to a 70-year-old heart patient. The system assumes that every patient can handle the physical stress of the pipeline, but for seniors with a heart history, the safety margin is incredibly narrow. One innocent test can pull you out of your safe zone and drop you into a high-risk medical crisis before you even realize what happened. This brings us to a truth that goes completely against everything you have been told about senior healthcare. Most people assume that getting more information about your body is always safer than getting less information. We are conditioned to believe that more testing equals more protection. But here is the belief-breaking insight that you must remember for the rest of your life. After 65, an uncritical desire for more data can easily become your greatest health liability. In a body with existing coronary artery disease, medical testing is not a free pass. It is a highly calculated risk. When a doctor says, "Let's just look," what they are actually saying is, "Let's open a door that we cannot easily close." Once an abnormality is documented, a doctor faces immense legal and systemic pressure to treat it, even if treating it provides absolutely zero benefit to your daily survival or your quality of life. The system operates on a philosophy of action. It wants to cut, it wants to prescribe, and it wants to intervene. But if you are over 65, your primary medical goal is not to gather an endless list of microscopic data points. Your goal is to protect your functional independence. Your goal is to preserve your daily energy, keep your heart stable, and protect your mind and body from unnecessary trauma. You must begin looking at every single recommended test through a completely different lens, not the lens of "what might we find," but the lens of, will the answer to this test actually change how I live my life tomorrow, or will it simply subject my heart to an unneeded storm? Armed with this understanding, we can now look directly at the 4 specific medical tests that carry the highest risk of triggering this dangerous downward spiral for heart patients. The very first test on my list that I would heavily question after 65 if I had heart disease is a routine, asymptomatic carotid artery ultrasound. This test sounds like pure common sense. A technician runs a cold gel probe over your neck to look at the large blood vessels supplying blood to your brain. The goal is to find blockages before they cause a stroke. But if you already have a history of heart disease, you almost certainly have some stable, minor narrowing in your neck arteries too. It is part of the same systemic process. Here is where the real damage begins. If the ultrasound flags a 60% blockage in a person with 0 neurological symptoms, the medical pipeline immediately moves toward a heavy surgical intervention called a carotid endarterectomy to clean out the vessel. But multiple clinical data sets show that performing this surgery on someone without symptoms carries a 2 to 3% risk of actually triggering a major stroke during the operation itself. The procedure to prevent a stroke can dislodge a tiny piece of silent plaque and cause the exact catastrophe you were trying to avoid. The second test I would deeply reconsider is a routine cardiac stress test on a treadmill when you have absolutely no new symptoms. If your chest is quiet, you have no shortness of breath, and your energy is stable, a routine stress test is a dangerous trap. In patients with known heart disease, these tests have false positive rates that can hover around 40%. If the machine flags an ambiguous change while you are walking on that treadmill, you are instantly fast-tracked to a cardiac catheterization clinic. This is an invasive procedure where a plastic tube is threaded directly through your wrist or groin into your heart. The catheterization carries risks of severe bleeding, vessel tearing, and dangerous heart arrhythmias. And if they find a partial stable blockage, which is incredibly common in seniors, you will likely receive an unnecessary stent. Major clinical trials have proven that placing a stent in a patient with stable heart disease does not reduce heart attacks or extend your life any better than basic medication and a daily walk. But it leaves you with all the procedural dangers and years of mandatory heavy blood thinners. The third medical test you must approach with extreme caution is a routine screening colonoscopy after the age of 75, particularly if you have a known heart history. This goes against what we have been told for decades, but the physical reality of this test changes completely as we age. A recent landmark study published in the Journal of the American Medical Association evaluated the risks of screening colonoscopies in older adults. The researchers found that for seniors over 75 with no active symptoms, the rate of severe complications rose dramatically, completely wiping out the preventative benefits of the test. Here is why this test is so uniquely hostile to a heart patient. The danger doesn't just lie in the procedure itself, which carries a 1 in 500 risk of tearing the bowel wall. The real threat begins 24 hours earlier, with the intense bowel preparation. Drinking those heavy laxative solutions forces your body to rapidly purge fluids. For a senior with coronary artery disease or mild heart failure, This sudden, extreme dehydration causes severe electrolyte imbalances and drops your blood volume. Your heart is forced to pump much faster against thickened blood to maintain your blood pressure, which can easily trigger a silent heart attack or a dangerous arrhythmia before you even reach the clinic. The fourth test to carefully reconsider is the routine PSA, prostate blood test for men over 70 with a stable heart profile and 0 urinary symptoms. When you have a pre-existing heart condition, your tolerance for unnecessary medical treatments is significantly lower. If a routine PSA test comes back slightly elevated, it almost always leads to a painful biopsy, followed by aggressive treatments like radiation or hormone therapy. But prostate tumors in men over 70 are notoriously slow-moving. Statistics show that the vast majority of older men will live with these minor cells for decades without them ever spreading. However, if you are pushed into hormone therapy to treat it, those medications drastically alter your lipid panels, increase systemic inflammation, and can profoundly destabilize your underlying heart disease, trading a silent, harmless prostate issue for a life-threatening cardiac event. So how do you protect yourself from the modern medical assembly line without compromising your genuine health needs? I call this approach the SHIELD protocol. It is a simple, highly targeted strategy designed to help you regain absolute control over what happens inside the examination room. Every single time a physician suggests a routine screening test, especially when you are over 65 and your heart is completely stable, I want you to have 4 specific questions memorized, written down on a card, or saved in the Notes app on your mobile phone. First, ask your doctor, what is the false positive rate for this specific test in someone of my age group and heart history? This immediately signals to your physician that you understand the hidden risks of unneeded data collection. Second, ask, if this test reveals a minor or ambiguous finding, what is the exact, real-world treatment pipeline we would look at, and what are the direct risks of those procedures on my heart? Force the conversation to move past the initial test and look directly at the entire cascade of dominoes down the line. Third, ask, what happens to my physical health and overall life expectancy if we simply choose to monitor this with watchful waiting instead of intervening today? For many conditions found in older adults, careful observation is a highly sophisticated, superior medical choice that completely preserves your independent quality of life. And fourth, always ask, is there a non-invasive, non-surgical alternative that can give us peace of mind without triggering an invasive procedural risk? Any primary care physician or specialist who is genuinely in your corner and respects your autonomy will welcome these precise, logical questions. They will not feel threatened. They will sit back, drop the medical jargon, and help you calculate the true risk-to-benefit math. Protecting your health isn't about blindly saying yes to every modern test. It is about having the courage to ask the right questions before the cascade can even begin. Take those 4 questions and put them on a small card in your wallet today. There is someone in your life right now, a friend, a neighbor, or a family member, who needs to hear this message before their next annual checkup. You don't have to explain it all to them. Simply share this video with them right now. If this conversation has helped you understand how to protect your health and independence after 65, please hit the subscribe button. Next week, we are looking at the specific prescription medications that become highly toxic to an older heart. Take care of yourselves, stay safe, and I will see you right back here next week.